Welcome to Women's College Hospital. We're very delighted that you're here today to participate in this exciting event. My name is Heather McPherson, and I'm the President and CEO of Women's College Hospital. I would like to begin by acknowledging Toronto as a sacred gathering place for the many Indigenous peoples of Turtle Island. I want to recognize the ancestral traditional territories of the Ojibwe and the Anishinaabe, and to show respect in particular to the Mississaugas of the New Credit, whose territory we are gathered on today. It's a pleasure to be with you here today, for this event brings together researchers, students, and members of our community, all united in a goal to improve women's health. We hope that you leave today's event with a broader understanding how we can leverage digital technologies to advance the health of women and solve some of the biggest healthcare challenges in our system. Over the last century, Women's College Hospital has built a legacy in healthcare innovation. We believe that technology-enabled care is the next step to optimizing the patient experience and to deliver high-quality, equitable, and cost-effective care. Women's College Hospital is a hospital to keep people out of hospital. Our acute ambulatory care unit is a one-of-a-kind short-stay medical unit that provides urgent assessment, rapid diagnostics, and management of patients for both acute and chronic conditions. It was purpose-built to help avoid unnecessary hospital admissions and reduce visits to the city's crowded emergency rooms. And it has been very successful in doing this. Since September 2015, more than 2,000 patients were diverted from the emergency departments at both Toronto Western and Toronto General Hospital. And we've seen a significant reduction in inpatient admissions. Our next evolution for our acute ambulatory care unit is to use digital technologies to reach even further into the community and to provide primary care providers and patients at home the services that they need. We've also transformed the way patients can access specialist expertise and consultation. Our osteoporosis and dermatology programs are supporting patients from across the conference using video visits and e-consult technology. Virtual care has also become an important component of our surgical program and has helped us take surgeries that are traditionally done in the inpatient environment and move them to the outpatient. Through an app, patients and their healthcare team are connected for post-operative care that includes pain management, medication reminders, and video chat for wound care updates. The healthcare landscape is evolving at an unprecedented pace, and it's our responsibility to stay ahead of the curve. Virtual care is no longer an option, it's a necessity. Digital platforms and apps are revolutionizing the patient experience by making screening tools, services, and information more accessible. These tools offer patients more control when it comes to managing their care and well-being and making them partners in their own care. Throughout this event, you will learn about some of these digital platforms and their respective roles in propelling the health of women and the contributions to the enhancements of our health system. I would now like to invite Dr. Paula Rochon, our Vice President of Research, to say a few words on behalf of Women's Exchange. Thank you.
So thank you very much, Heather, and welcome everyone to our 12th Women's Exchange event. So Women's Exchange is based here at Women's College Hospital, and a key component of our work is the integration of sex and gender into all forms of health research, because we know that including sex and gender-based analysis paves the way for better science. And better science leads to better policy and to better programs, which in turn produces better care, which is ultimately what's extremely important. So through our work here, Women's Exchange is working with communities and changing the conversation around women's health research. Now we have 3 areas of focus. So one is the sex and gender component, which we do through our sex and gender support service that is available to everyone. We also support the uptake of women's health research through events like you're here at today, as well as other knowledge translation activities. And we enhance research in the community through our 15K challenge opportunities, and you saw some of those videos on your way in. For too long, I think it's clear that researchers and healthcare professionals have really overlooked the important piece around sex and gender. And today, it's really apparent that we need to incorporate these factors into the research that we do on a daily basis. It's not an option, it's something that we must do. And I'm extraordinarily proud here to be spearheading a team of very dedicated individuals who are transforming the way women, men, and gender diverse people experience health and access health care and respond to therapies. Now, I'd like you to visit our website, which is, I guess, on your program, www.Women's Exchange. We have lots of interesting material and resources there for you. And today, we're really excited to be hosting this event, applying a digital perspective to women's health. What an important topic. What a great event for today. Smart women are developing smart devices, which are truly revolutionizing the way that we access healthcare. Through cutting-edge technologies, innovations, our panelists that you'll hear from today are developing new strategies to help us achieve better health and better health outcomes. With their apps and digital platforms, they're optimizing self-management of treatment and facilitating early self-detection of serious signs and symptoms, something we maybe wouldn't have thought was possible just a little while ago. These women are breaking the molds by launching user-friendly, accessible, and very original screening tools that you're going to hear about that are promoting safer patient care. Today, we're going to hear a number of, I think, really thought-provoking presentations. There's also going to be an opportunity for you to ask questions, an opportunity for discussion, and for you to consider and discuss the ways that we can continue to leverage digital technologies to advance the health of women and to improve health outcomes. So it's going to be a great event. I'm really looking forward to it. Now, a couple of sort of logistic things just to make sure you're aware of. So first off, the agenda is in the booklet that you got when you came in, so you can follow along there. I think you'll find that quite helpful. If you want to use social media and you want to share your experiences, use the hashtag Women'sX, so it's right there, so we welcome your posts. There's washrooms just at the top where you came in, and as well there's accessible and all-gender washrooms just down towards the entranceway that are also available for you. Now, here today at any time, if you need any assistance, can you please go to one of our Women's Exchange team members, and I'll just ask them to stand up so you can see who they are. I think they've done an amazing job for today. So starting off with Robin Mason, who's our lead, Jamie Roebuck from Communications, Carolyn Bennett Abuayesh. Carolyn is at the back, okay. Nushin Hussain, and Stephanie Reed. So if you have any questions or things that they can do, please approach one of us. And thank them already for the wonderful job they've done.